Impaired nursing, substance and alcohol abuse. What is impaired nursing? Impaired nursing is when patient care or personal well-being is inhibited by drugs or alcohol. Studies have shown that 10% of nurses have alcohol or drug abuse problems, 6% have issues that interfere with their ability to practice, and 6-8% experience impaired professional judgment. Contributing factors. Stressors like insufficient staffing, excessive workloads, and family issues are factors that contribute to the nurse's dependency on drugs and alcohol. Fatigue from working 12-hour shifts, and 15.6% of nurses reported burnout, which is a physical, mental, and emotional exhaustion caused by overload. Physical pain from lifting and moving patients. Barriers to seeking help. There are different reasons and barriers to why nurses are hesitant to seek help for treatment, facing embarrassment of admitting they have a problem and what family, friends, and coworkers will think. Another barrier is cost. Addiction treatment can be costly. According to the Addiction Centers of America, treatment can range from $15,000 to $27,000. A lack of resources can also prevent nurses from seeking help. In 2016, there were 1,430 treatment facilities in California compared to Montana, who has 64. States with larger populations have access to more rehab facilities, while there are limited opportunities to help nurses who work in rural areas. Effects on patient care. Critical thinking skills are imperative when caring for patients, and nurses need to prioritize and make quick decisions to save lives. Unfortunately, nurses working under the influence are more likely to have impaired judgment, slower reaction times, and neglect patients to focus on themselves. Their flawed thinking can cause them to make medication errors that can harm the patient. Nursing image. The nursing profession focuses on individuals' care to help maintain a quality of life, and their appearance and behaviors can judge a nurse's professionalism. Nurses are genuinely polite, organized, patient, well-mannered individuals with positive attitudes. Chemically altered nurses can tarnish their image because they can appear disoriented, aggressive, short-tempered, and have poor hygiene. Organizations involved. The Board of Nursing is required to protect patients. If a nurse is suspected of having a substance abuse problem, it is reported to the Board of Nursing and an investigation is opened. The National Council of State Boards of Nursing published Substance Use Disorders in Nursing to reinstate safe practices for nurses who were known to suffer from alcohol or substance abuse. The ANA's position statement. The ANA published a position statement regarding substance abuse in 1991. It encourages substance abuse education in nursing and policies that support a drug-free work environment, reminds nurses their responsibility to report concerns of substance abuse, recommends treating drug diversion as a symptom associated with addiction instead of a crime, and suggests healthcare facilities use alternative discipline rehabilitation approaches to treat nurses. Advantages and disadvantages. Advantages. Nurses can get the help they deserve by attending inpatient treatment centers 12 steps, 30-day programs, or outpatient rehab facilities involving daily group therapy or peer-assisted programs that work with the Board of Nursing to help nurses with addictive conditions. Disadvantages. Substance abuse can turn into an addiction and have long-lasting effects on their health like liver disease, hepatitis, cardiovascular damage, memory changes, and possible death due to overdose. Consequences. A nurse's license is suspended while the Board of Nursing investigates. If guilty, they have to pay a fine, perform community service, or an administrative complaint is filed. An administrative complaint means a violation of the nurse's professional code has been committed or their license is revoked. If not guilty, the investigation with the Board of Nursing becomes public record and is reported to other agencies, which can prevent future employment. Ethics. Veracity, truth-telling, and being honest with patients. Being truthful is the most important when establishing a relationship between a patient and a nurse. That relationship can be compromised when nurses replace prescribed medications with substitutes or placebos to satisfy their addiction. Non-maleficence, the act of not causing intentional harm, is diminished when nurses divert patients' drugs, which is the transfer of prescribed controlled substances from the individual to whom it was intended to another person. 25% of nurses admitted to taking drugs from work, 12% confessed to ordering medications for their own use, 9% acquired waste from the sharps container, 8% returned stolen drugs with different ones, 4%
manufactured orders, and 1% revealed they replaced sterile needles with dirty ones.
My thoughts.
An impaired nurse is not only a danger to their patients, but most importantly themselves. As a future nurse, I think organizations should offer nurses free counseling, give them time off to process emotions after traumatic events at work, and require yearly training on coping. While it's hard for me to understand how one can suddenly become afflicted with addiction, I am not naive to think that it's impossible. My hope is that with widespread recognition and more support for nurses who are currently suffering from alcohol or substance addiction, we can start to decrease the incident. Even if the numbers do not decrease, hopefully, the end result for nurses and their patients